There's some anticipated cuts to Medicaid in the next coming months and years. This not only impacts working poor people, but it also impacts seniors who rely on Medicaid to supplement what Medicare does not cover. And Medicaid can cover a wide range of services such as inpatient, outpatient hospital services, physician services, laboratory, x-ray services, and home health services, among others. This is not an extensive list. But Medicaid often kicks in, especially for seniors who are living in long-term care facilities, such as nursing homes or assisted living facilities. What Medicare does not cover, Medicaid will kick in to cover. However, there are instances where the facility was not paid by Medicaid and that senior may not receive that service for the month, or that senior will be responsible for paying for that out of pocket. And I see this becoming a bigger issue as these Medicaid cuts come down the line. So how can you prepare? One, the demographic of seniors that are expecting to be eligible for Medicaid in the next coming months and years, you should be prepared that the requirements, the eligibility will become more stringent, making it difficult for you to be eligible for this program. Also, seniors who are currently receiving Medicaid, there will be cuts and reductions in what Medicaid will cover for you. So how do you fill the gap? Two solutions which I advocate on this channel: becoming a medical tourist or moving abroad. Becoming a medical tourist gives you the opportunity to travel to a country and receive treatment and services that you will not be able to receive at a fraction of what it would cost you if you're receiving them in the United States. Now, moving abroad allows you a broad range of opportunity to not only save on medical care costs, but also have the backing of a universal healthcare system, or at least insurance system that is affordable for you as a senior with a limited budget, as well as have more time freedom, better quality of life, financial freedom, and just peace of mind to know that if you needed additional care, that it would not bankrupt you as it would in the United States, and which it has done to many millions of Americans in the US. So those two options. I have begun to meet with my clients who are estate planning for them to begin thinking about or even applying for residency in certain countries that have a really good reputation in the medical field. Panama, Costa Rica, Colombia, just to name a few. This is an anticipation that by the time they need home health care services, that they will probably have to pay out of pocket for mediocre services. To avoid that, I'm advocating for them to think about applying for a visa in these countries in the event they need more extensive treatment, more long-term care. They already have residency in these countries. So if you're a senior looking at this is coming down the pike. It cannot be avoided. The best course of action is to stay in front of it and start to plan accordingly. And I understand medical tourism sounds like an exotic notion, especially if you've been living and working in the United States. But more and more people are coming to terms with the inadequate healthcare system in the United States and just cashing in the chips, understanding that they're going to have to travel to Mexico, to Costa Rica, to Colombia, to Panama in order to access healthcare. To rely on Medicaid in the long term is no longer a solid plan. So I am ringing the alarm regarding that, just to raise awareness so that you're not caught off guard regarding these changes. Again, it's just going to make eligibility more difficult, more stringent. And so seniors really need to start thinking about their long-term care plans. I'm going to, if you want to know more about specifically long-term care facilities in certain countries, I have a list that have been vetted where people have placed their family members in there and can attest to the quality of the nursing home facilities. So if you want to meet with me individually to discuss this, my link will be in the description box. Again, I do have a move abroad program. So if you want to move abroad, you don't know where to begin, and this is really lighting fire underneath you, the link will also be in the description box. This is a particular area that I'm going to be speaking with clients about, not only moving them, but also their family members, their aging family members, and applying for visas for not only them, their aging family members, facilitating placing them in long-term care facility and assistance with that. So if that's something that's concerned for you, the link will be in the description box, and I will see you next time. Please let me know if you have any questions or comments.